Hello, bro. How about your best life? Is there something new or hot? Today, we will see the central structures of the spinal canal, and we must know the clinical meaning of them. Without caution of these central structures, you cannot escape of dural tear. There are three layers at the midline in the spinal canal. From the outside, ligamentum flavum, epidural fat, and dura. The safe way through which we can access to the contralateral side with less risk of dural tear is the interval between the ligamentum flavum and epidural fat. Never, never, never try to go under the epidural fat when crossing the midline. You must be swallowed by a big lion when you try to walk under the epidural fat bush at the midline mountain. There is a central dural folding under the epidural fat layer. So when you put any instrument deeply into the contralateral side under the fat layer, you can injure the central dural folding directly. Always be careful of this central dural folding in the midline. In addition to central dural folding, the central fibrous band is located at the midline, which is connected with the dural membrane and under the surface of the ligamentum flavum. Don't try to remove it and clean up the midline area. When you pull out the central fibrous band forcefully, the central area of the dura can be injured. Please enjoy the BESS clip. And remember one thing. Under the epidural fat bush, there is a lion who is waiting to swallow you. The safe way is the interval between the ligamentum flavum and fat layer. Normally, at the level of L4.5 the root is covered fully under the distal lamina and the axilla is located just proximal to the distal lamina. In some cases, however, the axilla is not covered by distal lamina at the level of L4.5. and is exposed at the somewhat proximal area in case of a higher division root with wider angle of axilla. Another reason of dural tear is due to higher division of the root at the L4.5, normally at the level of L4.5. The root has a narrow angle just close to the distal lamina, but in higher division root has already been apart, so that there is a wider axillary angle at the proximal margin of the distal lamina. When you do punch the lamina at the middle of the lower lamina, you could misunderstand the dural lateral side as the root lateral side. And then, lamina punching by a Carrison punch at the just beside of the dura could injure the root at the axillary portion. In conclusion, don't start distal laminectomy at the mid-portion of the lower lamina. The starting point is always the distal edge of the lamina and go forward along the margin of the pedicle. When you try to do punch at the mid-portion of the lamina and unfortunately the root is divided higher than normal, then you will make root injury or dural tear.